March is National Colorectal Cancer Awareness Month. It is the second deadliest cancer that affects both men and women in the U.S., but it is also very preventable. Joining us now via Skype from Catholic Health is Dr. Daniel Popowich, the Director of Colon and Rectal Surgery at St. Francis Hospital. Thank you, Doctor, for joining us.
Thank you for having me.
So important to get the word out because, like I just said, it is deadly, but, and a big but there, it is preventable.
Yes, absolutely preventable.
And how?
The best way to prevent colon cancer is to remove the precursors that lead to the cancer, and those are polyps. And so colonoscopy is the method that you would be getting surveillance or screening for polyps and cancer. And if they're removed at the time of the colonoscopy, they will not transition into cancer over the next months to years. So colonoscopy is absolutely the best way to prevent colon cancer. Other things that we can do just includes living a nice, healthy lifestyle. As we know, for a lot of cancers, smoking, obesity, alcohol all impact the development of cancer, and the same goes for colon and rectal cancer.
You know, in the last year, we have been obviously dealing with COVID. A lot of people didn't go to the doctor. Do you see a lot of people, or fear a lot of people did not get their colonoscopies this year?
Yeah, unfortunately, that was a reality for several reasons. One, the fear of the patients coming into a center to be screened, but the other was a lot of the centers where colonoscopies were being done were closed. So there were a lot of patients who didn't get screening colonoscopies, or perhaps had a colonoscopy with a diagnosis of cancer and then never transitioned to get access to see a surgeon for proper treatment. So it definitely led to some very unfortunate delays.
And, you know, those delays can end now because it is safe to go to the doctors, right?
Absolutely. Please do not hesitate.
Now, colonoscopy, everybody, nobody really wants to talk about it, but and it's really the prep that people don't want to talk about, but that has gotten better over the years, right? Like, you just want to stress to take that fear away from people who might not go and get it because it's life-saving.
Yeah, I think what you just said is the most important part of all of this. It is life-saving, and so you should not be afraid to get a colonoscopy. The prep is annoying, but you're doing that in the privacy of your own home, and you can time that appropriately so that it won't impact with your work or your family life or sleep. The day of the colonoscopy is actually quite easy. You get some nice medication, you have a beautiful nap, you don't feel any discomfort or pain, and you wake up with the knowledge that we either have something that we need to deal with, or that it was taken care of, or that everything was fine. And it's an unbelievably safe procedure, and highly recommended to anybody who is of the proper age for screening, or if you're having any symptoms. Do not hesitate to have your colonoscopy.
Let's talk about some of the symptoms. What are they? What would you look for?
I think the predominant one for anybody to look for would be seeing blood in the stool. So although we might always anecdotally believe that blood in the stool will be associated with a hemorrhoid or something like that, that would be the first thing to be looking for, to be concerned for colon and rectal cancer, especially if you're at a certain age. If you're in your 40s and you're seeing bleeding, you just want to go to your doctor right away and let them know about that and determine whether or not it's something to worry about or not. As cancers grow, you can get some symptoms, and depending on where they are in the GI tract, you can have some alterations in the way you move your bowels, whether the caliber of the stool changes and it gets thinner, or if you start to become more constipated. Any consistent change in the way that your GI tract is working can also be a sign of a colon cancer. Later stages and signs would be things like unexplained weight loss and lethargy that go along with anemia associated with the cancers.
Does it affect more men or women or certain populations?
Believe it or not, it's pretty equally distributed between men and women. It's about 5% of the population. Same goes for men and women. It is, as you had mentioned, it's the second most deadly cancer in the United States of America. There's over 150,000 new colon cancers diagnosed every year, and about 40 to 50,000 cancer-related deaths from it. People who have a family history, predominantly first-degree relatives, so parents, sisters, and brothers, have an increased risk. If you yourself have a personal history of a polyp, you're at increased risk. Patients with other conditions such as inflammatory bowel disease, Crohn's, and ulcerative colitis will also have an increased risk. But it hits us all pretty equally. It doesn't matter what ethnicity or race or otherwise we come from. It's pretty equally distributed.
And we've been talking about screening. When should someone get screened?
So currently the recommendations, as of 2018, the recommendations change for your first screening colonoscopy. If you're completely asymptomatic and you do not have any increased risk factors for yourself, to have your first colonoscopy at the age of 50. That had changed in 2015 because there was a large population-based study that came out that showed that there's much younger people who are being found to have colon and rectal cancer. So currently the age is 45. And that might be a shame for people who were in their mid-40s and thought they had a couple more years to go before a colonoscopy, and it jumped back for them, and they got to get it now. But 45 is when we start our colonoscopies. For people who have higher risk, first-degree family members with cancer, genetic syndromes, or other conditions like inflammatory bowel disease, it would start at a younger age than that. But more importantly, this is for your asymptomatic individuals, people who do not have the current suspicion that they have cancer. If you are having bleeding, if you are having changes in the way that you're moving your bowels, those are different reasons to go ahead and get a colonoscopy despite what your age is.
So they moved the age to start lower because you're seeing more younger patients. Any reason why that's happening?
We're not sure. We are honestly not sure what it is, whether it's environmental or if it's dietary. But the age of developing cancers has definitely gone lower. It could also be that we're starting to do more colonoscopies on younger people, so we're catching them at earlier phases. But to date, it's unexplained. But I'm thinking that moving forward, as we continue to push for the whole population at risk to get their screens, we'll get the answers to these questions.
And I was surprised that after I did have my first screening, which it was a friend who made us go. You know, he had a little bit of a scare. He hung up he told us, make an appointment now, which we did. That once and there is so much peace of mind after that now.
Absolutely.
Yes. You really don't have to go back again for 10 years?
So as of now, if you have a completely clean colonoscopy, no polyps, no suspicious masses, no biopsies that show anything concerning, and you're an average risk individual, meaning no first-degree family members with the disease, or other conditions that increase your likelihood, yes, you are good for 10 years. But again, that's if you remain completely asymptomatic. If there's a change in symptoms, you definitely want to revisit. You know, there is a very small single-digit number where early polyps could be missed, and waiting 10 years could end up being a problem in those situations. So you don't want to ignore symptoms.
Okay, Dr. Popowich, thank you so much. This is so important. And, you know, we urge everyone, if you haven't been screened and you're 45, get screened now, 45 and above. Thank you so much.
Absolutely. Thank you so much.